As many get out and explore the wonderful outdoors around us in the summer, there are a few things you need to watch out for. To help us understand the medical threat of things that we encounter is family physician Dr. Stephanie Liu, aka Dr. Mom. Nice to see you.
Nice to see you.
So let's talk about poison ivy and the rashes. This can be a threat for people. What do people need to know?
Yeah, so poison ivy is an allergic reaction that occurs when your skin gets in contact with the oily substance in poison ivy.
Okay.
So you can get red, itchy bumps. It can even be blistery, and it can appear within 1 to 3 days after someone's exposed to poison ivy. The important thing to note, though, is one of the best things you can do is, if you think you've been exposed, is go wash it off right away with soap and water. And the reason is we know that the faster you wash it off, the less likely you are to even develop a rash or develop a severe rash.
Okay, so there's something that you can do if you think that you encounter it, but this is what you can look out for. Because as you said, 1 to 3 days, you might not even notice until you're well past the poison ivy that you came in contact with.
Yeah.
Okay, good to know. And then how do we treat once the rash develops? Is there a treatment there?
Yeah, sometimes, soothing creams with beta-glucan or even topical steroids can be helpful.
Okay, good to know. Now, ticks. Always a constant reminder to watch out for ticks. So there are a few different things to know about. Removing ticks, you got to be careful on how you do this, right?
Exactly. So ticks are spooky. I don't like them at all. So if you see a tick on your skin, right away, get a pair of fine-tooth tweezers, okay? And as close as you can, hold the tick as close as you can to the skin, pull directly upwards, and as you pull upwards, do it with gentle, steady pressure. Okay. If you see a few pieces of the tick that remains, our bodies are actually pretty smart. And what it'll do is our body, as the skin heals, will actually gently push out the remainder of the tick.
Okay.
And the most important thing is I said right away. And the reason we want to get rid of the tick right away is there are studies that show that the quicker you pull it out, the less likely you are to get tick-related diseases like Lyme disease.
Okay, now let's talk about Lyme disease. If you do discover a tick, if it is buried in there, does that automatically mean that Lyme disease is coming?
No, okay, not necessarily. And thankfully in Alberta, we know that the cases of Lyme disease are very low. Okay, so in order to get Lyme disease from a tick, there's two things that need to happen. First, the tick needs to have the bacteria that causes Lyme disease. Borrelia burgdorferi.
Okay.
And it needs to be attached long enough for the bacteria to go from the tick's gut into its saliva and then into you.
Okay.
And that's typically at least 36 to 48 hours.
Okay, so you have some time if you do notice it, but obviously early detection is key. So if you're out there, just do a quick sweep for ticks.
Yes.
Okay, now this is an interesting one. Hot tubs. A lot of people relaxing in hot tubs after a hike and things like that, but there's risk there too.
Yeah, so, I feel like the real, Debbie Downer, okay? Because, hot tubs in general, I go in the hot tub, everything's typically fine. But sometimes if you're sitting in a poorly maintained, poorly disinfected hot tub, you can get something called hot tub folliculitis. And so that's an infection of the hair follicles caused by a bacteria, Pseudomonas aeruginosa.
Okay.
And the reason I said poorly disinfected hot tubs is because Pseudomonas aeruginosa, that bacteria loves warm and poorly disinfected hot tubs, okay? And so what that rash would look like, this hot tub folliculitis, is red, pus-filled bumps that can be very irritating to the skin. Fortunately, in healthy individuals, within 7 to 10 days, that rash can self-resolve. But in some people, they can get a more serious infection where they can get a fever, or if you're immunocompromised, you can get more serious complications.
Okay, so is there anything you can do if you start to notice these bumps?
Yes, so cold compresses can be very, very soothing for it. And also, in severe cases, you may need oral antibiotics.
Okay, something to watch out for. Keep those hot tubs clean. Dr. Mom, thanks so much for being here.
Thank you for having me.
As always, if you'd like to follow along online, she is at Life of Dr. Mom.